What are you supposed to do when you're in recovery and you are suddenly supposed to take pain medication, or you have a surgery coming up and you know you're going to be on heavy painkillers? What are you supposed to do to prepare yourself? So I'm not a doctor or a addiction specialist or anything like that. I just share my story and my opinions on YouTube to help other recovering alcoholics and addicts through sharing my story and what happened to me. So I decided to make this video because I had a couple of surgeries over the past few years, and one surgery was right before I got sober, like a month before I got sober, and another surgery when I was about 4 years sober. And I remember what it was like. And I have a surgery coming up next month where I'm anticipating, well, they will give me drugs. So I'm preparing myself to know what to expect with that and how to deal with that. So I thought I would make a video to share my thoughts and my experience. My first bit of advice would be before you have the surgery, or say you got injured, or whatever the case is, whatever's making you have to take pain medication, to tell the doctor that you are a recovering addict, and tell them that you had a problem with alcohol, or you had a problem with pills, or whatever it is. So you have an addiction issue. So then the doctor would know not to give you too many pills, or not to give you too many refills, or not to give you the stronger, more addictive narcotics. So just let the doctor know that right off the bat so they can then adjust how they're going to treat your pain. Another tip I have, which is what I'm going to be doing, is to prepare yourself mentally. So research how the recovery goes for whatever your injury is or whatever your surgery is. Research how that goes for most people, and research what the pain is going to be like. And also, I found it would be helpful to write yourself a note when you're sober and clear-headed, without fear making, or emotions making its way into your writing. Write yourself a note for your future self, for when you are on pain medication. Write yourself a note to basically say, you're on drugs right now, but it's okay because a doctor prescribed them. Don't feel guilty. Try not to feel anxious because you're doing the best you can. You're just managing your pain. And write yourself to explain, to basically don't listen to that little voice that's in your head, because it will probably show up. And write yourself to say how good it feels to be sober, and how good it feels to be clear-headed and to have control over your senses and thoughts. And maybe even write yourself to say, I know it might seem tempting, but don't go off the deep end, and don't tempt yourself, and to stay on the path. And then maybe write down some things as to why you're sober. Write down reasons why you need to stay healthy, and write down things that are coming up a few months down the road that you're looking forward to. And maybe write yourself to say, you want to be clear-headed for those things. You don't want to go off the deep end. You don't want to relapse. You don't want to do all these things. Basically explaining all that to yourself, so that in the future, when you're recovering and you are on pain medication and you're feeling weak, you can read that and really read it and trust yourself to know that you are able to do the right thing, and you are able to continue on and then stop taking the pain medication, and then go right back to recovery and sober living. And after the surgery, or after your injury, whatever that period of time is when you're taking pain medication, don't tough it out, because the tissues actually won't heal as well without sufficient pain treatment. Also, untreated pain can cause something called wind-up, which means that the spinal cord is constantly bombarded with pain signals. So then that can lead to a longer recovery and an actual chronic pain situation happening, and you do not want that to happen. So keep up with the pain medication, and of course do what your doctor says. And it sucks, but narcotics might be what you're supposed to take. And there are some narcotics that aren't as addictive as others. Again, your doctor should know that you're in recovery to know, so that they can use their best judgment to maybe not prescribe you the higher addictive narcotics. But know that you might have to take them. And that's okay, because your doctor is the professional, and your doctor has done these surgeries before, or your doctor has seen other patients like you before with your injuries or illnesses, so they know what's normal, and they know how your pain will probably be. So trust them and do what they prescribe. But you also might find that you might not have to take all the drugs the full time that the doctor recommends, because they're going to give you some where they would see on average that their previous patients needed this amount of pills for this amount of days, but maybe your pain tolerance is higher. So you don't need to actually take those pills for that amount of days. I know for me, when I had one of the last surgeries that I had, after the surgery, they just prescribed Tylenol-3 and ibuprofen. So that was fine. But I remember the doctor ended up giving me a full bottle of Tylenol-3 with codeine, and then another refill. And I remember it being so much, and but I did take the ibuprofen and acetaminophen, NT3s. I took them, every 3 or 4 hours right after the surgery, just like they said, because if I didn't, the pain would start to get really bad again. And so I did that for the first few days because I really did need it. But I noticed that a few days in, I was starting to like that feeling. Even though they weren't strong pain, it wasn't strong pain medications. It was just Tylenol-3 with codeine. But I was sober for so long that any kind of drug going into my system, I felt it. And you'll probably notice that too, depending on how long you've been sober for. You might surprise yourself that going on, taking Tylenol-3s with codeine every few hours, you might feel it. So I definitely felt it. And around that time, a few days in, I was starting to get that voice that happens in the back of our heads, where it was saying yeah, you should take another pill a little bit sooner than what you're supposed to, so that you can feel a little bit more of the codeine effects. And the little voice was starting to say okay, the doctor gave you all of those pills. You're supposed to do what the doctor says, so you might as well just continue to take them. Even though the pain is getting a lot better and I'm recovering a lot better, but you got all those pills sitting right next to you on that table. It feels really good, and it feels cozy and warm, and you should probably continue to take them because it's a good feeling. You're off work, you're just laying around at home, it's not going to do anything bad. So that voice was starting to happen, and I knew that it wasn't a good thing, because I was able to recognize that that's my addiction brain talking to me. So I told my fiance what was happening. And that's what you should do as well. Tell whoever's taking care of you, or whoever you call on the phone, whoever you're conversing with, who you trust, tell them that little voice is starting to talk, so that they can help you control it, and they can help monitor how much you're taking, because sometimes we do need a little bit extra help, and that's okay. Because when we're in pain, it's hard to think clearly, so it's okay to rely on someone else to do some of the thinking for you. So like I said, sometimes narcotics are necessary, or sometimes you need to be on opioids. Other times, just ibuprofen or Tylenol might just do the trick. So maybe you'll have to take some opioids for the first day or two, but maybe after that you can switch to just taking ibuprofen, or just taking acetaminophen. And you might hear some strict 12-steppers will say that you should never take anything stronger than ibuprofen or acetaminophen. And in my opinion, I would prefer not to listen to that advice, because people in recovery are not qualified to tell us how to deal with our own pain. The only people who are qualified are the doctors prescribing the drugs. And pain significantly impairs us. In those situations, make your higher power your doctor, because they're the professionals and they're the ones who understand how the drugs help us. And you have to remember that the goal of treating pain isn't the absence of pain. It's to make yourself comfortable. So if you have to take an opioid for a few days after you have major surgery, then that's what you have to do in order to be comfortable. You might still feel some pain, sure, if it's really intense, but as long as you're comfortable and you're able to easily distract yourself watching Netflix, then that's the goal, and that's what you want to achieve. So during your recovery time, a lot of times the surgeon will call you or their office just to see how things are going. And if you find that your pain is too much, or you find that the drugs they give you are too much, that's your time to tell them, and they can maybe make adjustments. Also, you can always call a pharmacist, ask like, is it normal that I feel really loopy? Is it normal that I was told to take this drug every 2 hours? Like, is it okay if I stretch it out to 3 or 4 hours? You can ask them questions like that, because that's what pharmacists do. They know about drugs. So you might find actually that you hate the feeling of being on pain medication, because you're fuzzy-headed and you feel out of it, you feel stoned, and you can feel nauseated as well. And well, I think it's because in recovery, we're so awakened suddenly to our senses, and we're able to feel everything again, and we're actually awake and coherent. So when that's taken away, it can be really scary, and it can cause anxiety, and it can cause you to start to spiral to think that, okay, this is how relapse starts. You might have heard stories of people relapsing from having to go on pain medication for legit reasons. And you might start making decisions based on those fears rather than making sensible decisions based on medical guidance. But then again, you might actually like the feeling. Because I didn't like the feeling at first, and then I did start to like the feeling. So it could go both ways for you too. So just be aware. Another thing that you can do is to make up your mind that as soon as your pain is manageable enough, or gone, or virtually gone, is when you're going to stop taking the medication. That's what I'm going to do with my upcoming surgery. I'm going to make that hard line for myself and say, because usually you have to take a pill, every 4 hours for the first however many days, and then eventually you can start to wean yourself off. So I'm going to tell myself that as soon as I start to forget my doses, then you can start to really wean yourself off. And even if you still have half a bottle left of your prescription, that's when I'm going to decide, and you have no pain, that's when I'm going to decide that, okay, I'm going to stop now. And now I don't need to take any more. And then you can look up how to dispose of your medication. So that's it. If you're currently in recovery and on pain medication, know that this isn't a for sure thing that you're going to relapse and you're going to love the feeling and all of these horrible things. That's not necessarily what it means. I was afraid of taking pain medication my last surgery that I had, but I made it through and I was fine. Even though that little voice did start to talk, did start to try to convince me that it was okay to take a little bit more, I was able to recognize that, and so can you. And I was able to stop taking the medication before the prescription had run out, and I was able to not have to refill it, and so are you. You're able to also do that. Again, be in touch with your doctor and be open with your doctor and telling them that you are in recovery, and let them know your fears. And just be on top of it and have a good support system and trust in yourself and trust in your body, because your body wants to get better, your body wants to heal, and your body wants to not be in pain. So you just have to be patient with it and trust that it will go back to normal, and that your mental health will continue to get better and better. That's another thing. When you make it through times like this, times where that little voice inside of you comes back and you have to push it out and be logical about situations, and you make it out on the other side, and you didn't relapse and you didn't listen to little voice, all those little things keep building and building, and you get stronger and stronger and more resilient, and you get more self-esteem because you actually made it through. Whereas, think about it, if you were in active addiction and you had to take and you got injured, or you had to have a surgery, and then you were on pain pills, imagine how bad it would have been. Like, that would have been terrible for me. I would have been maybe even lying to say that I was still in pain and I still needed more drugs. For sure I would have done that. And I wouldn't have healed as well, because when you're in active addiction, your body is just it's not functioning as good as it could. So guaranteed recovery wouldn't have been as good as it could be when you're in recovery. Recovery as in when you're in addictions recovery, when you're sober. So if you have any questions or any other tips that you found that helped you, leave them in the comments, because I know lots of people read through the comments here too, and something that you write could help somebody else. So that's the whole point of this. That's the whole point of my channel, is to say what I found out, share it with you guys, and then in hopes that someone will see it and it will help them. So let's just keep this going. Have you been through surgery or anything like that where you had to take pain medication even though you're in recovery? Like, how did that go? It's scary, it really is, but you can do it. I did it. I'm about to do it again next month, and I'm mentally prepared, so I'm gonna be able to do it, and so can you. Give yourself more credit. If you're one of those people, I don't know if I can do it, well, you can. You're stronger than what you actually think you are. You are. I don't know you, but guaranteed you're stronger than what you think you are. Our minds are amazing things, and our willpower can do amazing things if you keep working at it and your willpower gets stronger and stronger. And that's what these situations do for us. They teach us things, and they teach us how to grow, and we become stronger out on the other end. So that's it. I wish you luck, and thanks for watching this video, and keep coming back. Bye.